Conducting immunization sessions deals not just with the vaccination procedures but other aspects as well. We will look into the steps and procedures in the preparation of the vaccines, the physical preparation done in the immunization area, and the setup of all necessary equipment used for the immunization session. We will also tackle how each vaccine is to be administered and the key information that needs to be recorded at the end of every immunization session and the recording forms to be used. What is the rationale behind conducting immunization sessions? Immunization programs must safely administer potent vaccines to all eligible children and women before they are exposed to vaccine-preventable diseases. It is important, therefore, to conduct immunization sessions that meet quality standards and follow recommended procedures. Good quality immunization sessions will ensure that targeted clients will receive optimum response and are encouraged to come back for follow-up vaccination. When setting up an immunization session, the following should be done before any of the clients arrive at the immunization session. First, take the vaccines and diluents out of the refrigerator. Next, check if the vaccines are safe to use. Vaccine vial monitor is a label on the vaccine vial which serves as an indicator if the vaccines were exposed to heat. This figure provides a simple guide for interpreting the status of the vial monitor on a vaccine vial. Checking the status of the vaccine vial monitor is easy but it can be tricky. Check the vaccine vial monitor under natural lighting to properly view the degree of change in color of the vial monitor. Next, prepare the vaccine carrier with ice packs. In preparing the workplace at the fixed site, the arrangement of the space in the health facility will affect how we work and efficiently complete the immunization process. The space for the immunization should be easily accessible to target children and women, but arranged so that they are not crowding the immunization area. The space should also be clean and not directly exposed to sunlight, rain, or dust. It should be convenient for the health staff who are preparing and giving doses of vaccines and quiet enough so we can explain and give advice. Put up a sign saying immunization clinic to show people where to come in and wait. The fixed health facility should have a space in the shade where women and infants can sit before being vaccinated. There should be a space for screening equipment, registration, vaccination, and recording. There should also be a table for vaccines and injection equipment, a chair for the mother to sit on while holding a child for vaccination, and a chair for the health worker. For other services during the immunization session, space and equipment must be provided as well. Set up a separate station for each of these services, which may include weighing babies and charting their growth, general health checkup and treatment, antenatal care, and health education. Plan for client movement through the immunization facility to ensure safety. This involves planning client flow to reduce the risk of accidental needle stick injury to the health worker or clients. For a safe clinic, keep the following in mind. If possible, a room with 2 doors should be used. Clients should enter through one door and exit through another so that people can move freely from entry to exit. Ideally, health workers will check the names and immunization status and then provide immunization services accordingly and the health information. If the facility has only one door, priority should be given to the person being immunized, like a child or his guardian, to enter, receive their vaccination, and leave before allowing another person into the immunization area. If possible, separate the registration tables from the injection tables to help keep children calm. Incorporate other health services provided into the flow and position them accordingly. For example, infant weighing table, nutrition table, or antenatal care. Whenever possible, separate women and infants to be immunized from those who have just been immunized, so people waiting are not distressed by babies crying and children crying. Assign someone, such as a community member or another health worker, to inform the waiting clients about the steps and flow of the immunization process. The person assigned should also monitor movements during the immunization session to ensure client flow is safe and efficient. After ensuring client flow, prepare the equipment needed. The amount of equipment will depend on the estimated number of women and children to be immunized. The following is the basic list of equipment and supplies needed whether in a fixed site or outreach immunization session. Plan the layout of the immunization workspace such that where possible, there is a separate table for vaccination and another for examinations if these are taking place at the same time. There is a space or barrier between the infant and all needles or sharp objects. Persons administering vaccines have his or her own safety box. Ensure that immunization supplies are within reach and that vaccine and diluents are kept in a vaccine carrier. Safety box should not be filled more than 3/4 of its capacity. The adverse event following immunization is another important matter. To determine whether a vaccine is causally linked or a mere coincidence to an adverse event following immunization, detailed investigation and causality assessment are required. In order to maintain and improve public confidence in the national immunization program, all healthcare providers should comprehensively be aware of all the aspects of AEFI and remain prepared to respond to public concern at any time. Timely response to public concerns about the safety of vaccines as well as prompt communication will protect the public and preserve the integrity of the immunization program. Plan the layout of the immunization workspace such that needles are disposed without setting them down or carried around. Only one child with his or her parent are near the workspace during vaccination. Hand washing equipment must be positioned next to the immunization table. You must always wash your hands and observe proper hand washing prior to giving the first immunization vaccines and when there is contact with dirt or blood. Record the vaccine given soon after it is administered and reflect on the accomplishments in the TCL. In preparing for the vaccine, always wash your hands. Safely prepare the vaccines for each child. Keep the vials in the foam pad inside the carrier. Use the correct diluent for each vaccine. Use a sterile syringe to reconstitute the vaccine. In administering the vaccine, position the child correctly. Administer each vaccine using the correct technique and injection site. After which, you must discard the used needles and syringes in a safety box. Place the empty vaccine vials, cottons, and other materials in the rubbish bin. Close the safety box when 3/4 full. The outreach site. The physical space during outreach immunization sessions may be in a building or in the open air. The building should be well lit and well ventilated. If in the open air, activities should be done in the shade. In arranging immunization site, make sure that there is a separate entrance and exit so people may move in and out quickly without disrupting other ongoing activities. The waiting area is clean, comfortable, and in the shade. People's movements are unobstructed from the entrance to exit and guided by signs and arrangement of chairs, tables, and guide ropes. The number of people in the immunization and other stations are limited and there is no crowding. Supplies and equipment are within reach in the immunization area. It is important to register all infants, children, adults, and pregnant women and other clients as soon as they arrive at the health facility or outreach site using the appropriate recording forms. The names of the clients could be recorded directly in the TCL for immunization services. Fill in the appropriate space except for the space services provided, which should be completed at the end of the immunization session. Another important aspect is the communication with parents during and after immunization session. The most important elements to observe in dealing with clients are the following. Treat the person with respect. Advise him or her of possible side effects and what to do about them. Explain when and where the next immunization session will be held. To ease the client's stress during the vaccination session, display a positive attitude through facial expression, body language, and comments. Use soft, and calm tone of voice. Explain why vaccines are needed, and explain what to expect. At the end of each immunization session, complete the health facility's immunization registry. Ensure that the vaccines that need to be discarded are properly disposed of. Ensure that the immunization work area is maintained clean. Complete the client's immunization cards. Write down the date for each vaccine administered, including vitamin A supplement given. Do not keep the card, but return it to the guardian, and mark the next immunization date on the card after every dose, and tell them when and where to return for the next vaccination. Tell the parent or guardian to keep the card in good condition. Explain the use of the card is to keep track of their own and the infant's health and immunization status, which could be very helpful for the health staff who will administer the vaccine during the next session. Remind the clients to always bring the immunization card every time they come to the health center. What to do if children are brought in outside normal session times? Infants and women eligible for immunization have contact with health services and could be immunized if vaccines were offered. Routine screening for immunization status should occur for all infants and women of childbearing age who visit health services for any reason. Ideally, eligible infants and women should be given timely immunization, but at a minimum, they should be given an appointment for immunization. Thank the parent for coming to the immunization session. Explain in simple terms the diseases that the vaccines protect against. Describe the possible adverse effects of immunization and what to do about them. Advise the parent on what to do if they need to bring the infant to the health center or hospital in case of a serious side effect. Finally, ask the parent if they have any questions. Make sure you repeat each of these messages more than once if necessary. The likelihood parents will remember your message increases if they hear the messages more than once.